Good morning and happy Friday to everybody. Today, what I want to do is I want to spend some time talking more about wellness and the things that would be helpful for people to know. Here we are in fall. Can you tell by my background, even by the color I'm wearing, that wasn't even planned, but it's a fall day here in November. And as we get towards the end of the year, a lot of times what people begin thinking about, other than the holidays, is how do I want to end my year and how do I want to begin the new year? A lot of people with health insurance are thinking about all the things that they need to do because either their deductibles have been met or there's things that they want to do before the end of the year. So when we talk about holistic wellness, as I did in the last video, we talked about one area being physical health. So what I want to spend some time on today is sharing with you some of the things that are really important that you stay up on in terms of physical health, physical checkups, and then I'll move into some other areas. So how often should you get a physical? I'm just wondering how often many of you have gotten a physical and when your last one was. Typically for adults, getting a physical every year is what's recommended. Now, what is a physical? A lot of times when I talk to people, I say, when was the last time that you had your last physical? And they said, oh, I went to the doctor 3 months ago. And one of the questions I ask is, well, what did the doctor do? Did they do blood work? Did they check your heart? What exactly was done? And a lot of times when we go in to visit our primary care physicians, we talk to our doctors, but unless we're going in for a complete physical, we don't get everything done. So your primary care physician is the person who manages sort of the general overall care of you. There are specialists in these days that doctors often refer out to. So we've got oftentimes many people on our medical team. But the first person who you really want to go to find out just kind of how you are is your primary care doctor. And when you go for an annual physical, the first thing that the doctor is going to do is to do some blood work, or sometimes what they do is they do it at the end of the visit and then they tell you to call back and check it. So what kind of blood work do you need to have done? You really don't need to ask your doctor a whole lot about this because it's pretty standardized. They do a metabolic panel, which looks at a variety of different things. They do a blood count. They check your white blood cells, your red blood cells. They look at liver function, kidney function. They look at different minerals and they look at your thyroid. So a variety of those things are all pretty standardized in the basic panels that they do. But a couple other things that are really worth getting checked out are your vitamin D level. Pretty much most doctors these days are checking vitamin D level, but if you've been feeling maybe a little sluggish or depressed or even anxious, just asking the doctor, are you checking my vitamin D level? Because most people tend to be deficient in vitamin D. Some of the other things, if your thyroid typically should be checked, if you have thyroid issues, ask your doctor about that. If you're dealing with any specific illnesses, all those things will be checked. So that's a big part of your complete physical. And then when you go into your doctors, they're going to be checking your blood pressure. Now, normal blood pressure is 120/80. When you get into anything on the top number, anything over 130, clearly over 140, over 85, 90, something like that, you're moving into a moderate high level, and that's something that you want to talk to your doctor about. So you really want to keep your blood pressure at about that level. Cholesterol, I forgot to mention that. Cholesterol is another test that they're going to be testing in the blood work. They're going to be looking for what's called HDL and LDL, the different types of cholesterol. And that those numbers are balanced out. They're also going to be looking at blood sugar. I can name all the tests, but your doctor's going to pretty much order all those anyway. So when you go into your doctor should be talking to you about just kind of, hey, how are things going anyway? They're hopefully about your mental health, about stress levels, about just social well-being. Hopefully that your doctor takes every part of you into account and really looking at you holistically. Any medications that you're on, you want to be able to share and to make sure that you're on the right dosage. So that is something that's really important that you do on a regular basis. Now, what are some other things that need to be done regularly? So women, of course, need to be seeing a gynecologist on an annual basis and getting at least a cervical exam done. The new recommendation is as particularly as women get older, that a pap smear only needs to be done about every 2 years, but for younger women, every year. And the other things that you wanted to check out are, you want to be checked for any kind of STDs, HIV, HPV virus, and your doctor will work with you. If you're sexually active, you want to make sure that you're getting those tests and checking on a regular basis. Okay, so that a breast exam is real important, and your gynecologist is going to do that. For women over 40, you should be having a mammogram. They're recommending every year. A lot depends on your own personal history, but that's something that if you've reached the age of 40 and you haven't had your first mammogram yet, it's pretty good to think about that. Once you reach the age of 50, you want to start thinking about your first colonoscopy, just to get a baseline and to rule out any polyps that might be in your colon, which can be caught early. What colonoscopies do is that they prevent colon cancer. And I'll tell you, I have to be really honest. Years ago, I was scared to death of having something like a colonoscopy done, but the medications that they give you today, you don't even know what's going on. So it's not something that you need to be worried about. Your skin care, getting your skin checked by a dermatologist, particularly as you start getting older, is really important. Once a year, seeing a dermatologist to just get a full body check. Now, of course, with any of these, if you are at any high risk because of past cancer or issues, or it's in your family, you want to talk to your doctor about, can you hold to the standards, or do you need to be doing something a little bit earlier? In terms of other types of physical issues, a lot of that is just really when things come up, don't ignore your symptoms, okay? A lot of times, especially with the COVID situation, a lot of times people are saying, oh, I've got this really bad cold, or I've got bronchitis, and they ignore it. And it turns into something worse, like, pneumonia, or, something that takes a lot longer to get rid of. So this isn't so that you run to the doctor all the time. We don't want to create hypochondriacs in our society, which could potentially be happening with some people, but to take ownership of your medical care. That's the most important thing. You know your body better than anybody else. So you want to basically own that. Now, immunizations are another big thing. What types of immunizations do you need? When we were kids, we all got immunizations to go to school. We couldn't even go to school unless we had things like, oh boy, what was it, polio? And I think back then it was, I think they called it the DPT, which was diphtheria, and they had, I think whooping cough was one of them. Then as time went on, kids were vaccinated against measles and chicken pox. And so all those immunities were done when we were kids. Today, what they have out, they're having young people get vaccinated with HPV vaccine to prevent hepatitis B. That's one of the big ones. As we get older, what do we need? Tetanus shots are definitely something that we need to have every 10 years. Again, getting older, the shingles vaccine, once you reach, I believe it's 50, I think it's 50 at this point, you can get the shingles vaccine. It's actually today, it's a 2-part vaccine. And then when people get to over 65, they can get the pneumonia immunization to help prevent pneumonia. Of course, there's your flu shot annually, that even if people, every year the flu shot changes, but people who get the flu shot, and even if they do get some type of flu, the symptoms seem to be less. And I know then, of course, the COVID vaccine. And I know there's a lot of controversy about that, but this isn't we're not here to really talk about that. These are just the recommended immunizations that people can get. And if you were curious about that, I wanted to put that out there for you. So in terms of general health care, that's real important. Dental care, getting your teeth cleaned twice a year. That's pretty much the standard. If anybody has any other kinds of health issues, dental issues, and of course you would do that more often. Now, what about mental health care? Now, mental health is one of those things that we don't check in with a mental health professional like we do a dentist every 6 months, right? Though I think it's not a half bad idea. If you've ever been in therapy, and a lot of people, I know a lot of people in my practice, they just check in every now and then, especially when things are stressful, to have a mental health professional who's kind of on your side, I think can be a really helpful thing. Mental health is not just about going in because you're in crisis. It's about personal growth, having somebody support you. Anybody who might be struggling with any kind of an addiction or just sort of questioning that, depression, anxiety, that's a good time to go in and maybe get some advice from a mental health professional. A lot of times, as we become adults, we're dealing with trauma from our childhood, or it could be trauma that's happened recently in our lives. And trauma is something that we're dealing with emotionally, but we're also holding trauma in our bodies. And so to be able to talk with a mental health professional about how to deal with that trauma, both at a psychological level, but sometimes even how to get it out of your body. I know at Primrose we do what's called polarity therapy, where we actually do body work and energy work to help people balance out their system from whatever it is that's going on, whether it be an illness, an emotional issue, a trauma, but to help the body get in balance energetically can be very, very healing and helpful to people. So we're talking about, what I've talked about really is the physical well-being and the emotional well-being and some of the things that can help you. One of the things that I really believe in and what I do with my clients is, and I've mentioned this earlier a little bit, is I really try to empower people to take ownership and responsibility for their own health care. So many people in earlier generations would go to doctors and they believed that the doctors were the experts and that they knew everything. And doctors are experts in particular areas, but doctors don't know everything. Doctors don't know your body and your mental health issues in the same way that you do. We need to make sure that the doctors understand where we're coming from and what we want. You know, an example of that might be around medication. I know for myself, I know medications that agree with me and medications that don't agree with me. So if a doctor wants to prescribe something and I'm like, no, that's not going to work for me. And he's like, well, are you allergic? Or she says, you can take it if you're not allergic. I'm like, nope, I don't want that type of medication. Or if you want to take a more holistic approach to things, have a conversation with your doctor about that. I really do believe when it comes to holistic health that the combination of Western medicine and holistic health is really important. I have some very, very good doctors that I go to in my own life. I always try to collect names and specialties of doctors who people have had really good experiences with, because you should have a good relationship with your doctor. That person's there, they're working for you. If you're looking for a new physician, one of the things that I recommend is that you do a consultation. You don't have to go in and see the first doctor, agree to become a patient of the first doctor that you talk to if you're looking for someone new. See, you know, they're doing so much over the video, you know, telehealth these days. See if the doctor's office is willing to do a consultation over telehealth with you. Just go in just for that part of it. You need to know that that doctor, whoever you're seeing or whatever specialist you're seeing, is going to be someone that you're comfortable talking to. Now, let me talk about specialists just for a second. I mentioned your primary care doctor, and your primary care doctor oftentimes will be referring out to other types of doctors. because primary care doctors today aren't doing everything. So some of the things that you might be referred out to for would be things like an endocrinologist is often a type of doctor that people are referred out to. That would be things like thyroid issues or diabetes or other types of endocrine issues. Neurologists would be a referral out. A cardiologist, a neurologist is dealing with the nervous system. A cardiologist is somebody who deals with the heart. An orthopedist. Orthopedists deal with the bones, the skeletal system, and the muscular system. An allergist, okay, whether it be a food allergist or and you may have some environmental allergies. Those are all specialties that people would be referred out to, and there's tons of other ones. And again, do the same thing though. Own your own care and consult with these doctors first to make sure that you do like them. I just think taking responsibility for your health is so important. Now, another piece of this is, when do you go to a doctor, a Western medicine doctor, and when do you decide to seek out holistic treatment? There's no right or wrong answer for this. Some people go through Western medicine first, and they find that it's not really helping them. So then, myself or people at Primrose or other holistic wellness professionals start getting phone calls saying, nothing's helped. Can you help us out? And we come in and have a conversation about that. Some people do it totally the opposite way. They go to a holistic professional first, and then they find that maybe that's not working as well, or the holistic professional says, you know what, I think that you may need to see a Western doctor to get some type of medication or some testing done. So it can go either way. I actually believe that the combination of the two is really important. I think that Western medicine definitely has its place. There's some wonderful advances that have taken place in terms of curing disease, and there's some wonderful medications that are out there that help people with chronic conditions and with pain. But I also think that holistic wellness really provides us, helps our bodies to heal in the way that it's supposed to heal. Energy balancing tells the body to do what it's supposed to do naturally, and sometimes it needs some help. The mental health part of it is so important because there's the mind-body connection, that one affects the other. In my last video, I mentioned my last video, I mentioned the video on Netflix called Heal. It's a documentary that talks about the mind-body connection, and I think it's wonderful. It's worth seeing for anybody, but it really brings together Western medicine and some alternative options for people as well. So what I wanted to do today is I wanted to just give you a little sense of what are some things that you should be looking for in terms of your own health care, what tests you should have, when you should go to the doctors, talk a little bit about physical health, mental health, when to reach out to your mental health professionals in addition to your physical health professionals, when to bring in holistic care. And mostly, the most important thing is to just empower you to take responsibility for your own medical care, your own health and well-being. You know you better than anybody. If you have any other questions, you can call Primrose Healing and Wellness at 650-425-3451. You definitely can also email us at admin@primrosehealingandwellness.com and check out our website, primrosehealingandwellness.com as well. We look forward to hearing from you and answering any questions that you may have. Take care and definitely enjoy the rest of your fall.